a stark warning from the medical field to treat weight loss seriously. We are talking about Ozempic. It's a diabetic medicine that, when used off-label, can also cause rapid weight loss. But the high demand and cost has deterred many from accessing this medication, with others searching for cheaper alternatives. And that is the problem. Those alternatives could kill you. The FDA now investigating reports of 2 deaths and dozens of injuries after people allegedly took fake medications which claimed to be the real deal. The FDA says there have been 28 reports of adverse effects from counterfeit Semaglutide in the U.S., and it's an even bigger issue in the U.K. Officials there have seized over 300 of these fake injectables, and that's only what has been caught. So joining us now is medical weight loss physician who is board certified, Dr. Sue Decotiis. Dr. Decotiis, thank you so much for your time. First of all, what is your reaction to knowing now that the FDA is investigating this?
I'm not surprised at all. I mean, I practice in Midtown Manhattan, and I have patients from all over the country and even international patients that have told me that they couldn't get the medication to the regular physician, and they went to one of these online platforms and they bought medication either from an online platform or directly from one of these bogus pharmacies. And they either didn't get results at all, or they got sick, or they felt they got ripped off, or they couldn't get the medication after a week or so. So it was a very strange situation. So state and federal law does not allow legal pharmacies to sell medications directly to patients under any circumstances. So that's number one. Don't buy directly from any pharmacy. And I think online platforms are dangerous anyway, because even if you're getting the right medication, you're not being monitored. No one is following your weight as far as your body composition, like how much fat are you losing? Are you losing muscle? Are you hydrating? So it's really important for patients to get proper medical care in order for the medications to work. And also, in my practice, my patients have done better than a lot of the patients in the studies because they were followed so carefully. And when they got to their ideal weight, we tapered them very slowly and followed them with body composition scales for quite a while. It made such a difference in their long-term success and health.
Absolutely. Yeah, that supervision, that monitoring is so important. And doctor, I don't know if you've heard of this, but there are reports that these bogus versions of the drug have also made their way onto actual pharmacy store shelves. How could that happen? If it's true, how can people protect themselves if they think they're actually getting the real thing?
Well, they should really, if this is the case, they should really let their physician know, and their physician can get the medication tested. And of course, go to a reputable pharmacy. I mean, I think a reputable pharmacy is going to make sure that they're getting the medication from the right source. So that really should not happen. And if it does, that pharmacy could really be shut down. Absolutely. So there has to be proper protocols in place.
Well, doctor, there are some obvious risks here when it comes to taking fake versions of any drug. But talk about the potential side effects and risks, even when dealing with the real thing here. You touched on this when you talked about the importance of the supervision, the importance of the monitoring, because there are real side effects and risks.
Right. With the real drug, you can get a lot of GI side effects, especially in the beginning, such as nausea, vomiting, maybe reflux, a little constipation, maybe even a little abdominal pain. But with my patients, we really slowly bring people up so that they can tolerate the drug, and we make sure that they're really well hydrated. And my patients who are watching this are probably laughing because I tell my patients, you may need to drink about 1 gallon of water a day in order for your body to burn fat effectively. Because as you know, fat is mostly water. So when you're burning fat rapidly, you can become very dehydrated. And if you're dehydrated, the side effects of these drugs, especially in the first month or 2 of treatment, could be severe. So hydration is key. And titrating the patient up in dosage is very, very important.
All right, my last question for you, doctor. Knowing that there's this risk of getting a fake version of the drug, even if the risk, when we look at the big picture, is actually low, what is your advice to people, wanting this drug for weight loss, not only for insulin management, knowing that a lot of people don't necessarily, go to the doctor all the times, go and have that continual monitoring and supervision?
Well, I think realize that there are a lot of really good compounding pharmacies out there, and some of them provide a drug that's just as good, if not better, than the commercial pharmacies, like the big pharma drugs. So realize that. And if you're overweight and you can't lose the weight on your own, you really should consider taking one of these drugs. Of course, there is a shortage, so you may have to pay for the drug yourself. But if you get it directly from your physician, you really should be safe, because it's up to your physician to really make sure that the drug is sourced properly. And it's so important for your health. I mean, we're talking about, obviously treating diabetes, but lowering the risk for cardiovascular disease, sleep apnea, liver disease. People just look and feel so much better. A lot of my patients find that they're more focused. Work is easier for them. They have more energy. A lot of people have been able to get off Adderall, get off Xanax, and some even antidepressants. So I think the pros outweigh the cons. And as you know now, Tirzepatide, which is known as Mounjaro, has now been FDA approved for weight loss. So that's really a great thing. And there's another great drug that's coming down the pike, and that is something called Decotiis. That's another Lilly drug. And that works, believe it or not, even better than Mounjaro and Ozempic, because it works on 3 receptor sites, so that weight loss is really faster, smooth, and there may be less side effects. So hopefully we're going to get this drug next year. So I'm really excited about Decotiis.
That is, certainly exciting news. And hopefully people will not be trying to cut corners and potentially be getting, fake versions of these new drugs as well. Dr. Sue Decotiis, thank you so much for your time.
Thank you.